For those who don't know me, my name is Fergal O'Brien. I'm the Deputy Vice-Chancellor for Research and Innovation here in RCSI, but I'm also an active principal investigator and involved in PPI research myself. So I'm really delighted to welcome you here to RCSI for the launch of the 4th annual PPI Ignite Network Festival, which really celebrates the enormous contribution of the public and patients to health and social care research. And I think, this festival has grown over the last few years, and it's become a really important annual opportunity to showcase and promote the network's work, to connect with researchers, organisations and the public, and to generally increase the awareness of PPI. And over the month of October, there's a great lineup of events around the country, and I strongly suggest you visit the PPI Network website for more information on some of these events. From my own perspective, working with PPI partners has been enormously beneficial to my research and research teams, and I see some researchers from my own group here now. It's improved how we think, how we've designed experiments, and how we deliver. And I'm especially pleased that Ciara McCarthy, who has been a fantastic PPI contributor on a project funded by the Research Ireland Amber Centre and the Irish Rugby Football Union Charitable Trust, who I've had the privilege of working with over the last 7 years. He will take part in one of the parallel sessions tomorrow. And I guess as an example in RCSI of our commitment to PPI, when we were developing our strategic plan, we reached out to a number of our PPI contributors, and they actually helped to form the institutional strategy, not just our PPI strategy, but our education and research strategy when we launched it a couple of years ago. So it's a real honour to host the event here in RCSI. We have a fantastic programme of talks, workshops, and even a podcast, which was recording some very special guests. I think it's great to see the growth, the geographical growth and activity, because we're delighted to welcome participants from across Ireland, as well as colleagues from the UK, Denmark, Brazil and India, and even possibly further afield. And I think this really has begun to showcase where Ireland sits in this area. We're really becoming global leaders in the space. So thank you to everyone who's making an effort to join us from overseas. The festival, as everyone is aware, is organised by the PPI Ignite Network, of which we're one of the 7 lead universities, working alongside national and local partners to help to build capacity for embedding quality PPI in health and social care research. We are very grateful to our funding from Research Ireland and from the HRB, and with the co-funding from all the universities. And I want to really acknowledge the exceptional leadership of Professor Sean Deneen and Adele Murphy, who have guided the network over the past 5 years. And I also very aware of the huge amount of work that's gone into preparing the proposal for the next stage of funding. So I congratulate everyone involved across steering committees, advisory boards and the work package teams. I think it's a really, really exceptional proposal. Very confident this will allow the network to continue and expand its important work, and we are delighted that the central office will be established here following funding over the next year. This year's tagline is celebrating our history and embracing our future, and I think it captures the moment well. A chance sort of to reflect on the achievements of the past 5 years while looking ahead with ambition. And I think the expansion to an all-Ireland focus and including the technological universities is a major step forward and will really strengthen the scope and focus of the work that we will be able to achieve. And I really want to extend a warm welcome to colleagues from the new universities and from the new partner organisations who will join the network early next year. I want to really express a sincere thank you to Niamh Dillon for her exceptional work in bringing the festival together and for her leadership in promoting high quality research here in RCSI and bringing people together. That's what PPI is about. And Niamh, assisted by people like Michelle Flood, Maria Pertl, our programme managers, Lena Mohammed, and the students who are supporting the event are really been the key to the success of this to date. And I also want to thank our porters, catering and communications and our events team who will support the event here in RCSI over the next 2 days. And with that, I hope the programme sparks new conversations, collaborations and ideas. Above all, I hope it reminds us of the strength of working in true partnership. And as I say, I'm an active PI. I've seen the benefit of what PPI can do to expand, improve and lead to much better research. So thank you for joining us, and I look forward to meeting with you over the next 2 days. And I'm delighted now to hand over to Professor Sean Deneen. Thank you.
Great. Thanks, Fergal, for those kind words, and welcome. What a great celebration of our collaborative work around public and patient involvement in Ireland. My name is Sean Deneen. I'm a diabetes doctor based in Galway in the west of Ireland, and I have had the privilege of leading the PPI Ignite Network over the past almost 5 years, along with Edel Murphy, who has been, integral to the whole idea of the network, but also the festival. I don't think Edel has, the Galway train is delayed a little bit, but Edel has mentioned to me a number of times that the festival was probably the best ever return on a sentence in the original grant proposal. So I'm pretty sure it was Edel learning from things like Mehel and is it Mehev? Or no, there's a Bjáltana is the celebration across time and bringing together, different people. If I'm honest, I don't know much about Bjáltana, but I do know that this PPI Ignite Festival has been, as Fergal pointed out, and as I think and as I hope you'll see, a real celebration of what we're achieving together. So the format for this opening session is that I'm going to give you my personal reflection on the journey, and I will finish my contribution with the launch of a video. You will be the first people to see and hear the video, which is part of a series of impact videos that Edel and others have put together. So more about that later, but there's a launch within the launch, if you will. But I'm actually going to start by putting this around my neck because I honestly didn't plan this. It's going to sound a bit like, I was on the train on the way up and I put my hand in my pocket and found a lanyard and a name badge from the 10th annual Public and Patient Involvement Summer School. So because we're all bare below the elbows now, as clinicians, I don't wear the jacket as often as I used to, but I'm actually going to put on the UL PPI Summer School lanyard so you all know who I am for the rest of the day, but also because it actually does reflect, this is the corny bit, this kind of coming together of the different centres. So that's already nearly 3 minutes of me rapiding on. I better start. So the journey for me started. Thanks. That's brilliant. Yeah. With actually Ignite Phase 1. I have a single slide on Ignite Phase 1. For those of you not familiar, before the network was formally established, we had what I would call a nascent network made up of 5 sites that were lead sites, so universities that were funded to deliver PPI, build capacity within their institution. But it included 7 or more universities that were coming together and planning for a formal bid or a formal network, which was subsequently established. So the opening slide from me is, and I looked at this last evening and I cannot see myself. So I either took the photograph, which I doubt, or I was Osláthar on the day. But this is our institution, our university had a different name back in this was probably 2017, 18, Martha. And it's basically the PPI Ignite at Galway team. And clearly an event was being held in Islas. So this really was, I think, the beginning of the journey for me. And then we were successful in the bid to establish a PPI Ignite network, to ignite PPI within our health and social care research ecosystem. What a great name. And these are the 7 lead sites that participated in the, one reflection perhaps, the national office, which is in the center on this slide, is based in one of the lead sites, but I know we have been really attentive to not wearing the maroon jersey, but rather wearing the green jersey. And I'll come back to that. It suits the HRB, I shouldn't say it suits them, it facilitates their flow of money. The money goes to a single site and then is disseminated from there. That's how the funding works. The funding goes to a centre that is recognised as having the governance and the systems in place to manage a grant of this size. So that's relevant because it may be in the future, and I think it probably will be in phase 3, that monies will flow perhaps in slightly different directions, but they go to a university and they're then disseminated. So that may not be of great interest, but it's relevant, I think, to the way this network has been established. This is the maroon and the green. So John Gaffey, who has recently left us to start a PhD in the University of Oxford, and Casey Donaghy have been our research support officers within the national office, working alongside Edel and myself, but also working alongside Martha and the leads in Galway. So they have literally worn 2 jerseys at the same time. But as I mentioned, Edel and I, and there was learning for us, I think, from TMRN, another really strong network, which, we rise above being in one place and actually celebrate what we're doing together, and flying the Irish flag, as they say. I'll come back to that as well. Okay, so this was probably the first substantive output, I would say, from the network early on, quite early on. Any of you who were there at the launch of the Values and Principles framework will remember that it was a wonderful day celebrating, again, the network, but also just highlighting aspects of how you do this well, respect, trust, flexibility, transparency, empowerment and power sharing, collaborative and partnership working, equity and inclusion. Is there a hierarchy here? Possibly. Respect, trust. It doesn't happen overnight. That's part of what I've learned, or my reflection is that you can't just make these things happen. You can't just switch them on. But I personally have found this values and principles framework to be an underpinning of all that we do as a network, as an investigator, as a lead within Galway in the phase 1, as a national lead. And I do have a sense that whether people are aware of it or not, but this is true for a lot of people involved in our work. I think it is part of what has been successful about our work. And this isn't about the best or the worst way of doing things, but just to point out that there are other ways of doing things in this space. And in the NIHR, National Institutes for Health Research, the main funder of clinical research in the NHS, has set out a set of standards for public involvement in research, which are outlined here. There's clearly overlap with what I've just been discussing. But there is an element of, standards maybe being imposed or setting a bar versus values and principles which grow from the grassroots, as it were. And I'm not going to say any more because I think, you can all maybe reflect on that. Okay, so it is about the people. We've had quite a few. This is the 10th, and this was at least 2 years ago. I don't know how many in total, but we've only had 2 steering group meetings face to face. So we came into existence, during a global pandemic, and we know each other much better on screens than we do in person. But this was, I would say, a really strong meeting of the steering group for a number of reasons. One, it was hosted by our national partner, Maynooth University, which is coming on board as a lead site in phase 3. it was a coming together of not just the site leads, but also the program managers who met separately and together on the same day. And for me, these things, again, a bit like hanging the UL PPI Summer School lanyard around my neck, but I think these things matter. It was held in the John Hume boardroom. It's an all-island network, and I think he would have been proud of the work we're doing. These are the program managers, and you know, the site leads are important, but the program managers are more important in terms of getting the work done. You can challenge me on that if you like in the Q&A, but I'm certain that that is correct. These are the engine room or the beating heart or whatever analogy you want to use. In preparation for today, Edel and I had a look. We have had, so we have 7 lead sites. We have had 14 site leads, which is interesting. So Galway was the only site at the beginning of phase 2 that had a co-lead, 2 co-leads, but everybody has 2 co-leads now. I think that says something about maybe sharing the load, perhaps, but also it's that spirit of collaboration and teamwork and bringing people together from very disparate and very different kind of backgrounds. So we've had 14 different people in site lead roles. No, we've had 14. We've had 14 different program managers. I'm looking for the nodding head from Edel at the back, which is even more impressive, but also challenging. Because when a program manager comes on board, they need time to be brought up to speed on how the network works and just to get their head around the role. It's not a straightforward role. But I think, and Emma, I was just thinking about this on the train on the way up. We have 1 program manager who has become a site lead during the course of phase 2. Okay, so what are we about? Building capacity for high quality public and patient involvement. And how much of this is a slide reflecting the training and education hours delivered up to, this would be our 4th, most recent annual report. So it would be the 4 years, and the colours are cumulative across the 4 years. And it's impressive. How much of it would have happened without the network? Some, but I think not 50,000 hours. Okay, developing resources and guidance has been a big part, and I'm sure you'll hear more about this in the reflections from the work packages, but these are my own highlights. This is the Barrettstown work. I think there is a workshop today supporting PPI and laboratory-based research, led again by a number of people, but somebody from Maynooth, and I think that photograph maybe Maynooth. UCC Digital Badge, really, really great idea for bringing people into the PPI space, an initial kind of exposure. This is Jennifer Palin on your right, and you know, if we have a legacy, it's going to be people like Jennifer and her sister who got PhDs together. Jennifer was part of a collaborative doctoral award. I was a co-supervisor of her PhD, as was Patricia Carney. So she had the national lead for PPI and the UCC lead for PPI as co-supervisors. So she was going to do PPI well, and she did. And she, I think, you know, in her first postdoc job, which is under this roof with Ed Gregg and the Converge group here in RCSI, she has responsibility for coordinating a PPI panel across this data science collaborative, or this, you know, which, yeah, is I think just, again, speaks to this is the future, you know, this is how it's going to grow in Ireland with people like Jennifer. Again, I think you'll hear updates from Work Package 3 around the challenges that we've encountered with payment for contribution, but also some of the achievements there with, you know, not quite uniformity, because different universities have different policies, but we are getting there, I feel. And a big challenge are those people who are not able to participate, even though they really want to, because of social welfare benefits. But again, that is a difficult nut to crack, but there are people, I suspect, in the room who are helping with this. I want to just, so I'm looking at the time, 15. I've got a couple of slides left. This is my favorite slide from my entire journey in the PPI Ignite Network. This was our European Association for the Study of Diabetes, EASD, International Congress, and I was involved in delivering a session at the Congress last year on PPI, and we had people on my right from Denmark who have been interested in what we're doing and trying to create public advisory boards as an example. But on my left, we had people from Japan who knew nothing. This is called the East-West Forum, where scientists or clinicians or healthcare people learn from, East and West. And I'd love to say that PPI Ignite, has started to ignite involvement in Japan. That's maybe stretching it a bit, but it was a wonderful event, and I'm proud to have been part of it. And then, speaking of wonderful events, if you're not already aware, by the way, Fergal mentioned the festival, or not the festival, but the calendar. There's a function on the calendar, which I only learned about recently, where you hit month. I would encourage you to do that, because when you go into the calendar, you see a day, or you see the next event, I think it is. But if you hit month, and if you hit month for October 2025, it's very impressive. This is one of the events you'll see, and I would encourage you, if you haven't already considered coming to Galway for in person, or a bit like today, you have a hybrid option as well. So just a shout out to our national partners, in particular Avril, who's here. This is my segue now from where I am leading the network into the next challenge for me professionally, is trying to land a national diabetes registry in Ireland. And thanks to Avril for organising a forum, an Irish Health Research Forum, focused on this topic. I was part of a conversation with Robin Doherty from the CF Registry Ireland, and trying to think about how do we do this well in Ireland, and a big part of doing it well is building trust, and a big part of building trust is PPI. So for your information, the National Screening Service, so this is potentially the sleeping giant that is the HSE waking up to PPI, or what they call partnership, public and patient partnership as opposed to involvement. And it's exciting. NSS, the National Screening Service, is doing this really, really well, unbeknownst to me up to quite recently. And we're trying to learn from that. And if you scan that QR code, any of you, can join the Digital for Care patient panel, which Richard Green, the Chief Information Officer, I think is his title, has established, or has actually recently put out a call for expressions of interest. I apologise because I'm running a little bit over. I want to now, with Niamh's help maybe, introduce you. So you'll hear my voice at the beginning, and this is one of 3 impact videos that have been prepared, and you will hear from other people, some of whom you will recognise, about their take on the network.
PPI Ignite Network is changing how research is done, ensuring that people with lived experience have a genuine voice in shaping it by collaborating closely with researchers. Let's listen to some observations on the network from external stakeholders.
My name is Claire Kilty, and I am Head of Research at the Irish Cancer Society, which is the national cancer charity, and we're the largest charity funder of cancer research in Ireland. Over the last 8 years since PPI Ignite has started, I have really seen a great shift in PPI in Ireland, which is fantastic to see. PPI Ignite have been very much instrumental in putting PPI on the map in terms of the academic research community. As a charity, central to us is ensuring patient-focused research. I think since PPI Ignite has started, there's been a really shared commitment amongst us as a charity and researchers in the academic community to really drive patient partnership.
I'm Anna Cody, and I'm the PPI lead in the Health Research Board. I have seen real progress made thanks to PPI Ignite. It's been critical in embedding meaningful PPI across health and social care research, from individual projects to institutional strategies. Before PPI Ignite, few researchers in Ireland were familiar with PPI methodology and therefore didn't incorporate it in their research. Now, nearly every HRP application includes it. PPI Ignite has been a magnet to those interested in PPI, and it is a key strategic partner to the HRB.
My name is Susan Smith. I'm a GP in Dublin and Professor of General Practice at Trinity College Dublin. I have been involved with PPI Ignite for about 8 years. I've been a huge fan of patient and public involvement in research, probably informally throughout my career, but it became more formal once organisations like PPI Ignite formed, and they have provided invaluable support really in including the patient and public voice in my research over the last few years.
My name's Beck Hanley and I'm a member of the PPI Ignite International Advisory Board, and I also work in the UK to support the involvement of people with lived experience in research. I want to pick 3 ways in which I think PPI Ignite has had a real impact from my perspective on involvement in research. The first is that they've built collaborations between universities, researchers and people with lived experience to work in partnership on specific projects like involvement in lab-based research or training for early career researchers. The second thing is the PPI Ignite Festival, which has been amazing. And the third, but perhaps the most important thing, is the way that they've been working to change the culture of involvement in research. For the future, let's do more of that. Let's make involvement in health research the norm.
So in terms of future development, PPI Ignite has been instrumental in supporting early stage researchers, and it's important that they continue the great work in this area. I would say important for a future iteration of the programme is really ensuring that as many colleges and universities have the opportunity to engage with PPI Ignite as possible, particularly around the new technological universities that don't have a PPI Ignite office at the moment. And I also think strengthening links with the clinical community would be really beneficial too. Some sort of focused programme on patient partnership in the clinical setting would be really, really welcome.
The process for funding phase 3 has not been completed yet, but all going well, we expect that the network will grow to 11 sites. And that's important for ensuring that researchers have equal access to PPI support no matter where they're based. We hope to resolve some funding bottlenecks by increasing seed funding 5-fold, making it easier to start meaningful PPI before grants are awarded. I think that will really make a difference. One key milestone ahead is that more PPI contributors are stepping into leadership roles across the network, and that's a shift I'm really excited about.
So I'd like to see PPI continue to grow and develop, but I would particularly like us to ensure that we have a very broad and wide representation of our communities. And at the moment we're working to develop a PPI group for people living in disadvantaged communities across Ireland to support general practice research and development in those areas, and we'll be hoping for PPI Ignite support in doing that.
For further information on the PPI Ignite Network, please visit our online hub.
2 minutes over, but you'll excuse me. Well done to Adele and the team for producing those videos, and they will be available on the online hub in due course. So I'm going to now introduce each of the 5 presenters who will then be panelists, and I'm sure we'll bring chairs up. And we're going in the traditional order, numeric. So Martha is first up, work package, presenting an update on. It's an update and maybe a reflection. Yeah, on work package 1. Martha.
Great, thanks very much, Sean and Niamh. So my name is Martha Killalay and I work in the PPI Ignite Network in the University of Galway, but I'm here today on behalf of Work Package 1. So Dublin College University and HRCI Health Research Charities Ireland. And I'd really like to emphasise that I am presenting on behalf of the Work Package team. The slides have been created by us all. We have worked in collaboration for this piece today. So we have been asked kindly by Niamh to present on our key achievements over the last 4 years and what we have done within Work Package 1, and to share briefly some reflections on maybe some key learnings to bring forward into the future for public and patient involvement. So back in 2020, when the team were deciding for the Phase 2 grant application on PPI Ignite, we decided as Work Package 1 that we'd be focusing on building capacity across communities. So very much how to build PPI capacity at that broader spectrum, not just within universities, not just within the community, kind of bridging the gap between both. And at that grant application stage, what we were kind of nodding our heads together to see what was needed. And looking at the objectives that were created at that stage, we were thinking about that idea of building capacity for meaningful involvement across all stakeholders. And I think that meaningful involvement has been key to the last 4 or 5 years within the PPI Ignite Network in Phase 2. Creating participatory spaces for co-learning from diverse perspectives, so very much that full whole approach. Supporting collaborations across and within the network, so getting outside of ourselves. And I think Work Package 1 really managed to do that from the very first day, by it being that cross-sector, cross-collaboration in that leadership team, university and charity organisations. So that has worked really well. So thinking about then, what did we do, how did we find out what we needed to achieve, and how did we go about doing that? One of the first activities that Work Package 1 did as a team was create a survey to do a scoping review of what was actually out there. So we were aware that PPI had been around for a long time. When we were beginning in 2021, there had been the Phase 1, the first 3 years, and there had been lots of work happening outside of the network. So we did a scoping review of the training and resources that had been developed so far, to provide a snapshot of what was out there and what we needed to do. We needed to identify gaps in where to build that capacity amongst the community. We also committed to doing a second review of the survey, so that has just happened this summer. We have shared that survey with the lead sites, so the universities within the national network and our national partners, and so in some instances some local partners also have completed the survey. So to capture any new or updated training and resources that have been developed through the lifetime of the network. And we are currently analysing the responses, but I suppose I can give you a little hint on what is coming out of that analysis at the moment, is that we are identifying that there has been an increase in training and resources that have been developed throughout the lifetime of the network. And really importantly, these training and these resources, these activities that have been created, are not just sitting within universities. They're very much being co-developed by charity organisations, community partners, universities outside of the PPI Ignite network. So it's very much a large snapshot of a large approach across Ireland, which has been really positive. So back to our initial scoping review, one of the gaps that were identified was resources for PPI and lab-based research, capacity in that area. So in 2021, we went about creating a sub-working group to bring this idea forward. Within that sub-working group, there was 2 entities established. One focused on creating a scoping review of existing resources out there, nationally and internationally, in the lab-based space, and another group focused on creating a resource, so creating a module outline for within universities and for PPI contributors to enable training to happen within the PPI and lab-based space. So these were 2 massive pieces of work that were done by many different individuals from different universities, different charity organisations and different PPI contributors involved, much wider than the core Work Package 1 team, and that's where the strength and the depth came into that. Another kind of key activity through Work Package 1 over the years has been the shared learning groups. So each of the universities and the organisations involved, DCU, University of Galway and HRCI, have shared learning groups. So we run these out of our universities or out of our entities, but they're very much a core activity aligned with building capacity across communities. There are many different shared learning groups across the network that do fantastic work in PhD research, one in lab-based research here in RCSI. And this is a great opportunity to create spaces for different people at different levels, different stages, to come together and discuss involvement in lots of different spaces, like children and young people, facilitating PPI, and PPI happening within the research active charities area as well. On to the next key activity that took place during Work Package 1, which was also identified through the initial Work Package 1 survey. We identified in that survey in 2021, as I have mentioned, that there was a lot of resources out there, but we were maybe having resources in particular areas that were very niche. How could we utilise those resources in different areas? So, for example, you might have top 10 tips for involvement in involving children and young people in research, which is a fantastic resource. But if me as a researcher needed top 10 tips for involving adolescents in research, I could use that, but I might need to make some tweaks. So how could I go about doing that? So as a team, we decided that we would create some sort of tool to adapt existing PPI resources and how to go about doing that appropriately and efficiently and effectively. So the purpose was to co-develop a process for adapting PPI resources and training. And similar to the PPI and lab-based research, a sub-working group was established. So a call was put out and anyone who was interested in this space could get involved. And thankfully many people got involved with lots of different expertise to establish this. So initially there was a review of best practice internationally in relation to the intellectual property issues on how do we actually go about doing this. If we're going to be adapting existing work of people, how do we ensure that this is correct? And then a review of existing processes around adaptation was reviewed. And this is what was established. So a very simple method to adapt a PPI resource. So first of all, starting with identifying what you need to develop. If there's something out there, if there's something on the PPI Ignite Network Hub, have a look. If it might be of use, contact that author and let them know that you're planning on adapting this. Consider what it is that you need to adapt. Looking at the PPI Ignite Network values and principles, so really ensuring that we're doing this in a way that's efficient and meaningful to ourselves, considering looking at the EDI lens, that equality, diversity, inclusion, and then at the very end, acknowledging the resource owner, so that initial resource that you looked at to adapt, acknowledging that. And then third of all, a key activity that took place over the last year was to evaluate PPI training, so very much in key with the network objective of improving the quality of PPI happening across Ireland. We established a set of materials that would help us to evaluate our PPI training happening within the network and outside of the network if people would like to use it, with very much the goal being to improve PPI training across Ireland, so learning from the attendees of different PPI trainings how to enhance what it is that we're doing. So question bank was developed, facilitator's guide and checklist, different survey templates, and slides for inclusion within your work. So you're identifying, you're planning, you're considering, and then hopefully you're sharing. So as a collective, Work Package 1 some of us came together last week to think about what key learnings do we have for the future. So now that we're at this phase where we are, fingers crossed, March 2026, transitioning to a new stage, what would we like to bring forward from the work that we have done and how we have worked collectively? And I suppose something that we feel has worked really well was the impact of the cross-sector collaboration and having that co-leadership from the very beginning, from the grant application stage back in 2020, where the charity organisation HRCI and the two universities involved were very much working collaboratively with that strong, mutually reciprocal and respectful partnerships. That it was at that leadership stage. The value of the sub-working groups within Work Package 1 has been incredible. We wouldn't have got the work done that we have achieved without going beyond ourselves, without reaching out to the communities, to the patient organisations, to the charities, to the different universities, to different even research centres within our own universities to get that broader expertise. And the level of expertise that came and the passion from different people involved within the working groups has been just incredible and really admirable. And that allowed us, as I have said, a focused progress on specific agreed priority tasks while we could continue maintaining that shared vision of building capacity across communities. So honing in and out of sub-working groups has been really excellent for bringing the work forward and getting lots of different people's inputs and insights. One learning has been that sharing and creating co-developed and co-created resources has been fantastic, but it doesn't necessarily lead to implementation and use. So something that we are trying to learn and trying to figure out is how to maximise the potential of what we have done. So those co-created resources, how do we go beyond sharing our resources to actually embedding them? Do we need to take a different approach going forward in terms of how we're creating resources and what resources we're creating to really ensure that they are meeting the needs of our research colleagues, our charity colleagues, our colleagues in healthcare professionals, our PPI partners? Are we looking at it, doing it the right way? So how do we actually implement what it is that we're doing? And finally, a key learning, and I think this comes up within research and academia at every stage, is that idea of the sustainability of the funding, the moving forward, and the equity of funding support across sectors. I'm in a really fortunate position that I'm in a funded post to do PPI, but that's not the case for everybody within the network, within any kind of research project where you have external and internal partners. So that equity of funding and support. And I suppose finally, key learning is the challenge of balancing the workload within your general demands on your day-to-day and the work package demands. So really trying to carve out the time and having that kind of protected time to do this collaborative work is really important. So that's just a snapshot of the key achievements of Work Package 1. So thanks very much everyone for listening.
I'm conscious that you're having an awful lot of talk at you. While we're changing to our next speaker, if there are any burning questions, please put up your hand after each one. I'm going to stop using numbers. I was just sitting there thinking, I met our foundation year medical students in Galway earlier this week, and some people refer to the class as 0 MD, as opposed to 1 MD or 4 MD. And I asked them, and they really don't like being called 0 MD, understandably. So I'm going to stop calling this session work package number. I'm going to say that was a brilliant exposition of the building capacity network activity. And next we have John, I think, or Emmy, and both of you, giving us an update on igniting PPI in the next generation. Much better than work.
And turn it over to you to say everything.
We're going to plan how we do this just on stage in front of everyone. Thanks very much for the invitation to present on Work Package 2. Work Package 2 has been all about embedding PPI into undergraduate and postgraduate education. And from the very outset, it's been co-led by UCC and UL. So hence why both myself and Dr. John Salzberg are co-presenting today. So a very brief update for you. So just to say, while we're co-led by UCC and UL, we've very much worked collaboratively. We've had a working group of over 30 individuals from across the PPI Ignite Network, mostly institutions, because our work is developing PPI education, but we have had input from PPI contributors and organisations as well. And we've very much worked collaboratively, I think we can say, over the last 4.5 years. So lots of Teams meetings, Zoom calls, Jamboard. Before Jamboard finished up a couple of years ago, all of our meetings involved Jamboard. For those of you who don't know, Jamboard is an interactive whiteboard feature. Lots of Mentimeter, Miro board. Most of our meetings look something like this. Very colourful, very messy, very creative, but lots of brainstorming and lots of collaborative decision making. So we had a Gantt chart initially that was written into the HRB application that was submitted, but I'm not going to spend too much time. We probably can't even read the detail on the Gantt chart. What we really want to do today is just focus on three of many key achievements that we've had to date. The first being our principles and learning outcomes for PPI education. The second then being an accredited PPI module that we developed for postgraduate students. And then the third being the National PPI Awards. So on that note, I might hand over to you, John. Do you want to speak through?
Thank you very much. So the first thing that we did, the first product that over the first 2 years that we decided to work on, because we knew what we wanted to do, is of course create and embed PPI in accredited education all across Ireland and make it a model for how this could be done everywhere else in the world. But to start it and do it properly, first what we needed to do is create pedagogical principles on which these would be founded, and then the learning outcomes that would be driven through whatever learning products that we created. So as Emmy said, through something that looked a lot like that, I think that's actually might be the one from the learning process. I'm not sure. Oh no, this was the first. This was the one. And I can't tell. They looked so much alike. It was. We spent probably a year, or the better part of a year, doing this to figure out what are the learning outcomes and what are the pedagogical principles. And I think actually we started with the learning outcomes. I can't even remember now. I think we started with the learning outcomes, which then drove us to the pedagogical principles. So these are the things. So you're not going to have to read these here, but you can actually scan or just look for them on the PPI National Network site, because they are archived there as tools. If you are ever building your own teaching deliverables, these have been created in collaboration with at least 30 people across the network over a period of many, many workshops online, and then work between to synthesize what came out of the workshops, then returning those syntheses back to the workshop participants, working on them some more. And this iterative process created learning outcomes both at the module level, but also most importantly at the course level, at the program level. And what's most complete and what's most useful are those program level learning outcomes. So if you are trying to learn how to do PPI, how to engage meaningfully with patients, other members of the public, to create evidence that they need for their own action and change, these are the outcomes you should be looking for, and this is how you should work towards them. And then once we created that, we went through another process to create the actual pedagogical principles. So if you were teaching these, how can we practice the way we talk? If it's going to be a PPI, a participatory process that we're trying to teach people, how do we embed that as much as possible into the way that we feel teachers and learners should cooperate to actually move this knowledge along? So these pedagogical principles, and both of these, by the way, are very much based on those value principles that Sean talked about at the beginning. They're very compatible with them, and they were being developed at the same time, and they are reflected in the principles that we have here, both in terms of the outcomes and the pedagogical principles. So once those were in place, we had a good format, we had a good basis to be able to say, okay, now we think we know what we need to build, or at least the network itself has come to some sort of working conclusion to what we need to build and how we need to deliver it. Then from there, it was on to probably the much more formidable task to create something really, really meaty, which I'll turn back over to you for.
So once these principles and learning outcomes were developed, we moved on then to developing a new PPI educational offering. So we kept it quite broad in the initial Gantt chart that we would develop a new educational offering. We didn't say what that was going to look like because we really wanted to co-develop that with our working group. So again, lots of brainstorming, lots of Jamboard, and there was a number of key decisions that we made quite early on in the process. That would be that the offering would be a module. It would be an accredited 5-credit module. It would be beginner or introductory level. The content would be general, and it would be aimed at postgraduate students specifically. We agreed that there were common needs across the network, and therefore it should be offered as a network offering and then delivered through the different lead sites. And because there was so much existing content that people had across the network, we agreed that we would embark on this collaborative development process to develop the module. Again, lots of brainstorming. And we finally landed on the idea that this 5 ECTS module would be delivered through a series of 8 two-hour workshops. So you can see from the workshop titles that they're really taking the student through on a journey from the introduction to PPI, what is PPI, right through to the history and theory, partnering with organisations, partnering with individuals, the how to do PPI, the do here is supposed to be in inverted commas actually, building relationships, values, morals and ethical considerations, and then finally reporting and evaluating. So it's taking the student through on a journey from the what is PPI to how you can report and evaluate your PPI. So from there then we embarked on the collaborative development process. So we set up subgroups. We had over 45 individuals involved in those subgroups to develop content. So we had research and teaching staff from across the network. We had individual PPI contributors, representatives from organisations, students, and so on. So we've very nice dynamic groups, and I see many of you actually in the room, which is fantastic. So we developed the content, and then we piloted the module here in RCSI, and I see a few students in the room, which is brilliant, and also in UCC as well. So we'd nearly 30 students undertake the module in that pilot. And I should say a lot of the workshops were co-facilitated by PPI contributors and representatives from different patient and charity organisations. And we also involved PPI contributors in the assessment of the module, which was really, really incredible and very worthwhile. So huge success, if I may say so. We had really positive feedback from our students that undertook the module and also from our co-facilitators. So we ran it again. So the pilot was in April 2024. We ran it again in April 2025, and we plan to do it again next semester. And I'd really encourage anyone here in the room who might be interested in either taking the module or in delivering it at your own institution, please do come and have a chat with us during the coffee break. The content is there for a rollout. So from there, I'll pass back to you, John, for the awards.
And actually, before the awards, I want to say also that, which I should have said before, that those the learning outcomes and pedagogical principles aren't just for us to use internally. They're there for anyone at any university, our partner institutions through Ignite, which is more and more as the years go by becoming everyone, at least on this island. But there's still more to come. And then beyond the island, and just for everyone to use, we want to be a net exporter of this bit of knowledge. And one thing I can say that aside from the introductory module that was so excellently created and piloted here and had great success in its first running, these principles have also been specifically used in the launch of UL's professional diploma. So it is being used by another university as well to teach PPI and PHR and using those learning outcomes and those pedagogical principles. So it's one step, and we try to get it everywhere. We want to get it across everywhere in our network. We want to get it everywhere outside of our network. So the third thing that was the major deliverable from our work package about training and building academic capacity was creating a student award. Now, I don't actually want to say too much about this right here because I noticed that these slides are exactly the same ones as I'm going to say tomorrow right after lunch during the launch of this award. So all I really want to say now is, first of all, thank you so much to my site lead, Professor Hilary Moss at University of Limerick, who was spearheading this, and along with Stephanie Daly, who is our I don't even want to call you interim. You are our program manager since Lorna left to become one of the HSE's regional patient engagement leads, which we're very happy, and then we dragged her back into the professional diploma, so we can get some, whatever out of her. But between that and their wonderful process of working online with their entire national team over a period of many workshops, have created something with all of the lead sites and partners throughout Ignite for a graduate student award or a PhD student award to honor and recognize excellence in PPI in their thesis work. So this is something specifically intended to encourage students to do PPI in their thesis work, which can be very difficult, which can take more time, but people do it, and people do it very well. And we wanted to make sure that this was rewarded. So a process was undertaken over quite a period of time over the last year with all of you as collaborators, which created an award that is being officially launched tomorrow. And there will be the first awarding of this, I believe, in January. And I don't want to say too much about it because I'm going to say the rest of that tomorrow. So just to keep in mind that please do apply now after, well, I guess I'll say this tomorrow because it's going to be launching tomorrow. This is an overlap, but the point is here, we did it, and we're very proud of you for having done it. And I'm very proud of Hillary and the team and everyone together who came, who really, really worked hard and ironed out the differences between the different universities and what people wanted to do. Did you want to do it locally? Did you want to do it nationally? But came up with a prize that's going to be very, very good for students. Thanks.
Brilliant.
And did you have any?
I had one on learning.
Sorry, yeah. No, go ahead. I didn't realize. Yeah, absolutely.
Just a quick word on learnings. I definitely wasn't as thorough as Martha for Work Package 2, and I didn't consult with our working group on overarching learnings. But I do have a couple of learnings that I want to share, kind of more personal, really. There's a huge demand for PPI education out there. I'm seeing that in my email inbox every day of the week when students are getting in touch looking to do this module. So just to kind of flag that, there's huge interest amongst PPI contributors and organisations to be involved in this work. And that wasn't something I had entirely anticipated, but there's huge interest there. And then, like I mentioned earlier, involving PPI contributors in assessing, so even bringing them into the student presentations has been a really lovely experience. So I'm happy to speak to that during the coffee break. Just one more learning, and I'm sure many of you here can identify with this, you know, when you're working collaboratively. But for me, I have found it difficult to strike that balance. The balance between working collaboratively, being inclusive, you know, adopting a truly participatory approach in everything that we're doing and hearing as many voices around the table as we can, but also balancing that with just getting things done. And when we were developing the module in particular and we're working to internal accreditation dates and deadlines, I mean, you're applying for accreditation almost 2 years before the module runs. So you need to keep things moving. You know, when you say to students, we're doing this lecture on this date, the content has to be ready. So I just wanted to share that. I don't know if anyone here has any tips on that, but I would welcome any advice you have. So, you know, being collaborative and working in a participatory way, but also being able to meet your deadlines and actually get the work done. So,
brilliant. Thanks, Emmy.
Leave it there. Thank you.
Great. I feel like culture turned gamekeeper when I'm, you know, holding people to task for timekeeping when I have no free credit, you know, with going 2 minutes over. So next up is Dr. Emma Doris, program manager and co-site lead at UCD, and Emma's going to speak to the work that the network has done to try to identify and overcome barriers. Yeah. I need to speak with this.
Just for the people at home.
Yeah, sorry, for people at home. Emma is going to take us through the work that the network has done around identifying and overcoming barriers to at the institutional level. Thanks, Emma.
Perfect. Thanks, everyone. I believe we're quite over time, so I'm going to throw out at least half my slides, if that's all right. So Work Package 3 is all about sustainability of PPI within our higher education institution. So you've seen there's been an awful lot of activities happening. And what we really want is that we're not just doing activities in terms of public and patient involvement, they're actually becoming part of the normal practice of research. And therefore, we want them to be embedded within policies and practices related to research. So we are looking to see how we are doing that at different universities across Ireland and how we can learn from each other and how some have managed to get it done and how others haven't. So if you see me looking at my phone, it's because I have a timer on to make sure I'm all on track. So who are we? PPI, the Work Package 3 is co-led by RCSI and ECD. So they're kind of the leads who drive this work. But like all the other work packages, there's a huge amount of people involved in the day-to-day work of it. We have 3 key objectives, which are to identify and sustain successful developments that happen within universities, to adopt or adapt these developments in other universities, and to develop new and innovative forms of PPI implementation. So looking at how people have maybe done things differently and how we can capitalise on that and share that. So one of the key activities was looking at the extent to which public and patient involvement has been embedded. So how embedded is it if we look at the policies and practices at a university, not a project level? So what we did was we created an instrument that was an adaptation of the public and community engagement instrument that they use in the UK for the knowledge exchange framework. And we asked every university to fill this out in a self-assessment way. So we weren't assessing them. They were assessing how well they had done themselves based within their own expectations, within their own context. And people shared that with us centrally so that we could then look at how people were doing it. The idea behind this wasn't just that we had time to reflect on what was going well and how mature we were, but also that we would do this longitudinally so we could see over time if the resources and activities that we were doing within universities were actually translating and making a difference into becoming more maturing aspects. I'm going to come back to that a little bit later on because the first longitudinal version of that is in preparation to be released, so I can give you an overview of some of the key highlights for it. Another activity that we did was we had a specific focus on research ethics. Research ethics is a very important part, of course, of research, but it's also a very important part of participatory community and involving people within research. Now, we were looking at this as an institutional level, remember. There was other work happening that's looking at it on a project-based level, but we're looking at how institutions can become more open to actually having people involved on their ethics committees. We had 2 key lines on this. One of it was firstly to answer, when was research ethics approval required? Because that was a common question that happened. When do you need prior research ethics approval for PPI and when do you not? And the other question that we had was, okay, if we now want to embed people with lived experience onto our research ethics committees, from the committee and the institutional point of view, what are the challenges around that so that we can start to work on the solutions? So in terms of identifying the ethics statement that we came up with from a network perspective, we looked at what had been done in desk-based research, look at what had happened in other countries nationally, in the UK, in Canada, and Australia, and various different places. We had a multi-stakeholder group which included research ethics officers from within the institutions, as well as people with lived experience, researchers, members of the PPI community, and people from the national research ethics community. So we came up with a number of iterations on the statement as to what we thought was both ethically sound and clarifying for it. And that statement, I'm not going to read it out, it is available on the PPI Ignite Network. We then sent the statement out to have to get feedback on it, to make sure it was as understandable as we thought. We did this via a survey. We expected to have about maybe 40 to 50 people do the survey. We had over 200 within the space of 2 weeks, which was far beyond what we expected. So it kind of reinforced this certainly was something that people needed an answer to. So I'm just going to skip these in the interest of time. So then the next piece that we did was around identifying those barriers. And again, we did this through a multi-stakeholder approach. We looked at working with people from the research ethics committees within institutions, as well as people with lived experiences and researchers, to identify what are the challenges. And some of these, there are some values-based challenges, but a lot of them are also practical. You know, time, resource, training, upskilling. ethics, particularly when it's a research ethics committee, there is a degree of knowledge about what is expected from a legal and regulatory standpoint, and that can be a barrier sometimes. So how do we address this? It wasn't just about figuring out what the barriers were, but also starting to come up with some solutions. So that is also available at the moment. One other thing that we then did was we actually worked with one of the Institutional Research Ethics Committee to embed people with lived experience onto that committee. That has now been embedded for a year, and we are now doing a review on that to see if what we had thought and what we had expected to be the case was actually the case in reality, so that we can see the real world versus the kind of the expectations, and that work is currently ongoing. So I did mention that we did a repeat of the self-assessment survey to see how well we are maturing as a sustained and integral part of research culture within universities. So this is just hot off the press. It hasn't even actually gone to press yet, if I'm being honest. It will be soon. We again had 8 university sites repeat this, so everybody who'd done it in the first round repeated it, and we were able to a mix of analysis on it. And what I just want to draw your attention to, the spotted bars, that's what happened in 2022. So that's where people thought they were, how mature they were as a site in 2022. The blue striped bars, that's how people have reported back that they are maturing this time around. So you can see across the board, be it PPI within strategy, PPI support that's being given, PPI activities that are happening, how we are assessing PPI and how we are acting on the assessment of PPI. Across the network, across the board, there has been significant maturity that has happened just within the 2 years between doing the 2 landscape reports. And of course, that is what we want to see. That's the mean across all the institutions. But this is really important, particularly when you take into consideration that the PPI Ignite Network is not a huge funding resource that's given into each of the individual sites. So the amount of impact that it's having is so much greater added value compared to what you would have necessarily expected just from, if each site alone had gotten 360,000 for 5 years, Okay, so I will just skip through these because I know we are nearly done, but I will just say that part of this, what we also do is we look at what people have said, and we look at, there's my time, and we look at what's happening, and we come up with a number of recommendations arising. So these are recommendations based on what we think should be actionable within the time and resources that we currently have. So these are things that we can actively work on as opposed to idealistic things that we would like to do, should the big magic money pot drop from the earth. So one is enhancing PPI and governance structures. So what we have is really great pockets of it happening. What we don't necessarily have is formal roles for people with lived experience within governance structures. So, for example, on an institution level research ethics committee, that would be an example of a governance structure. So where it's relevant and where it makes sense that we need to actively advocate for this to happen. The other one is institutional policy development. A lot of what is happening is still quite ad hoc. So what we want to do is start to advocate to the management to actually make it more embedded within the policies and practices. The next one is co-creation of contributor progression pathways. So there is plenty of leadership, I think, happening within the university, but not necessarily giving those opportunities to people with lived experience. So at the moment, it's still inviting people in to work with you as opposed to giving them greater control and leadership within it. And there are leadership structures that we could open out. So that's something that needs to be worked on and advocated. Again, more learning from each other is essentially what recommendation 4 is, because there is a widening gap in some circumstances, which means that there's ample space for learning between each other. And finally, to encourage strategic review cycles. So at the moment, that learning culture of understanding what we have, where our gaps are, collecting the information, but then acting on the feedback, so not just collecting it and leaving it there, but actually actioning it, is still something that needs to be done. So I will leave it there. Thank you very much.
Thanks, Emma. That's great. And so next up is Dr. Liz Versacchi. Hi, Liz. Who's going to give us an update on the work that has been led by Trinity around quality frameworks and excellence in PPI. Thanks.
Lovely. Thank you all for being here. Thank you, Sean, and thank you, Niamh and Michelle, for all the work that you've done. I suppose I'm conscious of two things. One, of time, that we're running out of time, and also that I will be monopolizing your time this afternoon at 3:30, when I will talk to you more about the PPI Impact Framework. I'm also very conscious that I'm very new to the PPI Ignite Network. I just took on the role of Program Manager at Trinity in June, so I'm very conscious that all of you have been doing all this really hard work for the last 4.5 years, and then now I'm swanning in and pretending like I've done everything. So I'm not going to do that. So I will just briefly summarize the work that yourselves and my predecessors have done. Then I might just share briefly a few reflections about where I think we maybe could go over the next couple of years. So Work Package 4, which Trinity has led on, is all about promoting PPI excellence. So some of our objectives were to improve the quality of the network's PPI activities, to develop a culture of impact assessment in PPI. I'll be speaking more about that later on this afternoon, and really to create a shared learning space among our network partners. One of the things that Michael Foley led on, you'll know Michael Foley, my predecessor, and all of you, or many of you, worked on was the Values and Principles Framework. And I really like what you said, Sean, about it this morning, is that these are the values that really underpin all our work. And I think this is really nice to kind of use. I actually have a few printed out copies, which will be outside, or you can get them online. But these are really nice because they underpin all the work we do. And then also it's a reminder of why we do it, because if we kind of get stuck in the weeds of figuring out how to answer specific questions or how to support specific research projects, we can always come back to this and remember why we're doing it and how we can do it better. And these, as Sean has highlighted, these are the key values and principles. So the next big project was the quality improvement in public and patient involvement, so the quality improvement framework. And again, I'm very conscious that all of you worked on this together, and I had nothing to do with this. But again, Michael Foley led on this, and all of you co-created this together. And really, there are 3 tasks that are highlighted here in terms of what we wanted to do as a network in terms of PPI quality improvement. And that was really, how can we build a shared definition of what good or high quality PPI means? Because of course there are slightly different definitions of what it means and what high quality or rigorous PPI looks like. So developing a shared framework and shared understanding around that. Also, we want to look at how researchers and PPI contributors can judge whether we are actually doing high quality PPI, and then what issues that can we kind of look at together. And so ultimately then, yourselves and with Michael leading came up with this framework for quality improvement. And so I can share it later with you. You can look online. It was launched in October 2023, and it's there too if you're kind of wondering about, and I think we can do a lot more digging into this more, but it's there for you as a guide and a resource. So what are we doing next? So that's everything that yourselves and Michael Foley and my colleagues at the PPI Ignite Network have done. What are we going to do now between now and Christmas, really, now and the new year? Well, the final thing that Trinity is going to be delivering or leading on and delivering on in the next few months is this impact framework that we're going to be discussing and co-designing this afternoon. So I won't talk too much about this, but please do join us at 3:30. We will be here. I'd really love to hear your thoughts on the PPI impact framework and share the work to date on that. Just to give you a bit of a roadmap, we've started when I came on board. I started looking at the work that's been done to date. We held a really nice, in June, we had a really nice workshop on creating on the PPI impact framework and what would that mean for us at the UL Summer School. So that was a really nice opportunity to discuss that. And then now we're going to have another workshop today, and then we'll be coming up with a final report in November. So I just, again, wanted to say thank you to my predecessor, Michael, and to all of you who have actually done all the work on this. I suppose over the coming months and years, just reflecting on what I'd like to kind of see our work, what to work on more over the next few years and months is making that leap between, and I've discussed this with some of you, so apologies for repeating, but really kind of make that link between experts with lived experience, researchers, policymakers, and then service providers. I think that is really interesting. All of you have done so much work embedding PPI into an academic setting. Let's see now whether we can kind of complete that circle. As you said, Sean, the HSC are doing really interesting work in this area and with the regional leads on it now. So let's kind of see how we can do that more and really embed it not just in academia, but in services and in policy. So I'm really looking forward to that. And I will leave it at that, but I'm also, looking forward to seeing you this afternoon. Come join me at 3:30. Thank you.
Last but certainly not least, Edel is going to give us an update on the activity that is under the umbrella of the National Office and building a strong network, I guess. And then we'll have time for a Q&A and then a coffee break. So hang in there. I know it's a lot, but we've done a lot.
Okay, thanks, Sean. So thanks for giving us the opportunity to talk here about what we've done in Work Package 5. So Sean has already introduced the, excuse me, the National Office team. We've had John and Casey at different stages working with us. I suppose what's different about what we have done in Work Package 5, I was reflecting on this as I prepared. Work Package 5 was 100% what we were committed to. Whereas for the other work packages, the people leading it in particular, and Martha touched on this, had their local site leads loyalties, if you like, and then they had their network loyalties and responsibilities. So they were in a little bit of a different boat than we were in Work Package 5, which I suppose in ways puts more responsibility on us to crack through a bit more work, but hopefully you'll see that we did. So what were our goals? At the start we said that we wanted to, this was in our grant application, create a shared national identity and voice, promote a network of PPI excellence, and plan for sustainability of the network. So I won't tell you about everything we've done. I've tried to pick out a few things that might be of interest. So talking about creating a shared national identity and voice, we started by creating a visual identity, and I think everybody in the room has seen that logo already many times. It has really become embedded. We got input from representatives of all our stakeholders at the start, worked with the design company, and it has been adopted well across the network and beyond. We had a ppinetwork.ie is our web address, and even the fact that it's a .ie address as distinct from an institutional address is very important. The logo was adopted. All of the lead sites had these pop-up stands along the same lines, so wherever you were, you got a sense of belonging. This one is from DCU, but it could be from anywhere. We used our identity across all our communications and on our website, on our online hub. And the identity was a really important part of moving away, as Sean has already said, from wearing the maroon jersey to wearing the national jersey and being a national network. So identity really mattered, and we really tried to push it and encourage people to use it, and it has been fairly well adopted right across the board and has helped us internationally as a brand. Our online hub has been a very central focus for us in Work Package 5. The idea of having one location which was a magnet for things PPI. The resource section on this in particular, there's been a few references already to this by people around in the earlier presentations. We took a very flexible and open approach to the resources that go up there. People from the lead sites could volunteer their materials. There was no standard or gateway or level that you had to pass to get your materials up there. It was about sharing the resources that we were developing, and really important resources like the values and principles framework. You can search for that in here. The reports from the Work Package 3, even the statement on do you need ethics for PPI work, those important items are all available up there when you need them quickly. Each of the local sites, most of them, have their own local resources as well, and that's good for people locally, and it complements what's available nationally. The calendar of events, again mentioned already by Sean, we'd spend a lot of time supporting people to publish events, but again, it's a one-stop shop for all the PPI events happening around the country. We have a good network communications. Most of you have probably already received the newsletter that came out yesterday from Casey about the festival. It's a monthly newsletter, and we've got about 700 people on the distribution. The PPI Opportunities Notice Board was a piece of work that we really wanted to do to allow researchers put up information when they were looking for PPI contributors to get involved. But critically, we wanted it to be in such a way, sorry now, this machine has taken off on its own. We wanted to have it in such a way that it gave the power to the individual PPI contributors to see what was there and take the initiative to contact the researchers rather than the researchers always initiating the connections to an individual. So the PPI, or the Opportunities Notice Board, has been very successful, and people continue to use it. We also have, and again been mentioned a few times, our Public Advisory Board. This has been a very central part of our work in the National Office with Work Package 5. Here you see the members of the board. We've been up and running for 3 years and have the members, we've really grown as a group over that period of time. I'm not going to say any more because, as Sean has already said, On the Day on the PPI Journey is developed by 4 members of the PPI, the PAB. The whole programme has been developed, and it is a reflection of the PPI journey from the public voice perspective. So that's where we're going to explore learnings from the past, stories from today, and aspirations for the future in public voice. Another thing we've done under Work Package 5 has been work around impact, and you saw the first impact video there from Sean, and there are impact case studies up on the website from all around the network describing ways in which the work has had impact. When I was preparing for today, I thought about these words as a way to gather together some of the strands of what we've done. Flexible in terms of many different aspects of our work. I think responsive to emergent needs was a huge thing. Yes, we had our Gantt chart. Yes, we tried to deliver most of it. But there was so much else that 5 years is a long time. It went very quickly, but it is a long time. And it was really important that we did respond to emergent needs. There has been work done. Emma from UCD led a piece of work that we were very involved in around looking at the institutional aspects of trying to make PPI contributor payments, and we're now working with some individual PPI contributors in a piece of work led by IPOSI, trying to address some of the issues on the social welfare side. We have been fortunate that there have been a need to expand beyond the 7 lead sites. So we would have got a lot of contact from other institutions around Ireland, other universities, providing individual support at times to researchers from there, connecting them up to others, and maybe working at more of an institutional level with people like the Southeastern Technological University, who are keen to begin to build their own capacity across the network. And they too are going to be a new site in the next phase. The advent of research networks and research infrastructures over this period also brought new interests and challenges in the PPI space. It's one thing supporting PPI in a project, it's another thing supporting it in a clinical trials network or a CRF or so on. So we'd have done a good bit of work and delivered some training in that space. We've done some work with public sector agencies who are beginning to build public involvement, and I see 1 or 2 people in the room. That has been very interesting, a growth for us, and I hope a way of sharing some of the learnings from across the network more broadly into the public domain. We've had some international collections, and just before I came up, I saw Marla in the audience, and there's been various individually from lead sites, collectively as a network, our reach is going further. And very recently, again, Sean mentioned earlier on the resource about PPI with children and young people, and we've had a request from people in Brazil who would like to translate it into Brazil and use it in work that they have been doing. And that Brazilian connection is really interesting in that I think somebody came to RCSI first, then I think it was Marla, met various other people around the network. They ran an event as part of the festival last year, and they've another one planned for this year. So it's that network working together, I think, has been really influential. And finally, one of the things we've done a lot of is providing support within the network. And already Sean has talked about the turnover of programme managers, the amount of different programme managers there has been. And I think it's a great tribute to the network as a network. One of the entities that we have is an operations team, which sounds very grand, but it really is the programme managers coming together on a monthly basis. And I think that has provided an excellent element of sustainability where and I hope Liz is going to nod vigorously, when new programme managers come in, there's a ready-made support network there, and people can reach out individually on particular tasks. So we've invested quite a lot of time from the National Office in that support of new people coming. And finally, I suppose, around innovation. The National PPI Festival, I said to Sean recently, there was one line in the grant which says we will have an annual PPI Festival. And I think what it has grown to has been wonderful. It has been coordinated by different universities on each occasion, but again, with support from us initially. I think as well, going back to the visual identity, we carried the visual identity of the network into the materials that were developed in the first year around the festival. So all those banners and things that you've seen advertising events, they would have started when Galway hosted initially. I would have worked closely with Martha with the same designers so that the identity carried through. We've mentioned the notice board. We also did a piece of work on public leadership. We commissioned one of our public advisory board members to scope out what public leadership might look like in the next phase of the network. And it was a really interesting process. We very much left it up to the PPI contributor, the PAB member, to decide on the process, to consult with people and so on. And she delivered an excellent output, a recommendation on how to go forward. The recommendation wasn't adopted lock, stock and barrel, but the process definitely got the conversation going around public leadership in the network and within the institutions. And I think there's significant change going to happen in the next phase of the network, and this was a big contribution to that. And then, as I mentioned already, the PAB. So I might leave it there because, oh no, I have to say this. So we do exciting things, but we also do a lot of, I don't want to say boring, because I'm sure there's probably a HRB person in the room, but steering group, we've had 18 steering group meetings. We do things like financial reporting. We gather KPI data. Again, the poor programme managers are the people inputting it, but there's a process around gathering and reporting that. As I say, we've done work on network impact, and then there are other administrative responsibilities of being a host institution. So this has been the work of Work Package 5, and thank you for listening, and we will leave it there.
Thanks again. So I'm going to hand over now to Chiara, who's in the room. Yeah, and I'm going to suggest that we not sit for this, because I think it'll take a few minutes to get all the chairs up, and maybe I could invite the presenters to come to the stage, and I'll hand over to Chiara for any Q&A from yourselves. Thank you for your attention over the past hour.
Thanks, Sean. Yeah. Thanks, Will. Well, thanks, everyone. And look, you're very welcome up here to RCSI. It's lovely to have you all here. We're just going to take maybe 10 minutes, I suppose, Niamh, for a Q&A session, if that's okay. We love to have, actually, I meant to get my little note here. Sorry, apologies for that. So, yeah, I suppose, like, obviously, there was a lot of inspiring presentations. A lot of work has been done, and maybe, as loads of people have said, more to be doing. So, I'd like to open maybe some questions from the audience to see if there is anyone that wants to ask maybe specific questions to some of the work package leaders, or even just general questions for that. Is there anyone that feels brave enough to put up their hands? There you go. We have a hands up there. We might have a mic, maybe. Do you have a mic? Or else yeah, I think we can. But yeah, there you go. Now, don't go in the back, guys. Come on, come on up. Come on, closer. There you go.
Yeah. Thanks very much. Great morning and lots of learnings. So my name is Marina Cronin. I represent the National Office of Clinical Audit based here in RCSI. So this is great. We have an active public and patient involvement programme at NUCA. But there's huge learnings that I'm picking up here. I have two questions. I think one for the education programme. Yeah. So you spoke about education for people involved with PPI. I think what we're seeing is a piece around supports for public and patient interest contributors, and I think that's something that's a big gap, and I'd be really keen, maybe to work on something to develop that. That's one. Can I ask the second one before I go?
Go for it.
Yeah, 100%. The second one is for Liz and the people leading the impact piece. I'm really looking forward to this afternoon, because this is something we want to look at as well in our little organisation. What's the impact? We kind of have a sense of it. So a framework for this, obviously for the research community, but as you said, for all of the other groups outside of the research community that are involved in public and patient involvement, for clinical effectiveness as well as for the research community. Thanks very much.
Thanks, Emil. We might start from Emmy, if you're happy to answer.
So just to say, I suppose from the very outset of when we were preparing the grant application, we did distinguish between Work Package 1, which was about training resources, and then Work Package 2, which was education. So we define education as accredited PPI training. So it's more a question for you, Martha, so I can hand over to you. But just to say, I completely agree with you. I think there is a gap there in terms of the training that we provide for PPI contributors. Training for PPI contributors can be quite contentious. People have different opinions on, some people feel that training is professionalising PPI contributors, but others then feel training is absolutely necessary for building confidence and capacity. So that's something that we're very aware of, but I don't know, Martha, if you want to add to that.
Yeah,
from Work Package 1.
Thank you, Emmy, and I completely agree with what you've said there. And I suppose within the establishment of Work Package 1 in Phase 2, it was quite clear that we were an entity together to create resources and to facilitate building of capacity across communities, but that we didn't have the resources to do that capacity building at each stage for every single entity that needed that community. So I suppose that's why the calendar of events and things like that is so supportive, because all PPI capacity building pieces are there, one-stop shop. You can see what's happening, but there might not always be something that meets the needs of the particular group, or it might need to be closed training, and I completely understand that. I know in Phase 3 there's more of a maybe an integration and a focus towards moving and creating that capacity around public contributors and members of the public, and also kind of, as Emmy has said, tying the line of making sure we're not creating and making an ecosystem where we want amateur researchers, our PPI partners, to be researchers, that they're still very much in there for their lived experience. But I understand lots of people would like that training piece, or that confidence building, or maybe even training outside of research, and that we can facilitate that. So it's moving there.
Yeah, also to say that within the pedagogical principles that we created was a clear mandate that these educational deliverables should not just be co-delivered by PPI contributors, but co-designed and co-evaluated. So we're trying every way we can to everything that we create is co-created. All the learning deliverables for accredited classes, accredited courses and programs are co-created with PPI contributors, are co-delivered with PPI contributors, and then the impact of this will ultimately be co-evaluated with PPI contributors. And then, like the one step before that, there's also opportunities which can be implemented at different stages or different ways in different institutions. Is there an opportunity for co-assessment within the actual teaching and learning process with PPI contributors? So we're trying to work it in any way we can. And I think that the process of creating all this stuff, there were a lot of PPI contributors who were involved through all of this process. And so that immediately started building the capacity for PPI contributors to be able to get involved in teaching and in education and understand what their roles can be in it. But there is also still a much bigger role for other organizations in Ireland, such as IPOSI, which has training, other organizations, to be able to build capacity amongst PPI contributors across the country to be able to create more a groundswell of people who have the capacity to contribute to this education.
Liz, in the interest of time, quick answer, please, so that we can ask someone else. Thanks, Liz.
Okay.
Thanks, guys.
Lily, I'll be very quick and then pass on to Emma very quick. I suppose what we'll talk about this afternoon is an impact framework. There are lots of really good impact frameworks. Our network has come up with one. What we'll be talking about is a potential framework that can have room for and create that dialogue for everyone's interests and impacts to be included. So we'll say more this afternoon.
Yeah, and I think impact is a really important point. Research impact, we are a research network, but research impact hasn't even been defined from an Irish point of view. There is not a national definition of what we mean by research impact. So it can be confusing from the offset because different countries and different places have different definitions. So, we need to really define for ourselves what we mean. And I think as a network, our impact generally starts from our values-based proposition. Yeah.
Lovely. Thanks, Emila, and thanks, guys. One quick question. There you go. We have another one from the audience. Thank you. I think we have time for one more, Niamh. Yeah, perfect. Yeah.
Perfect. So first of all, congratulations for the amazing work that you are all doing. It's amazing. It's my first time here in the PPI festival or with the PPI involvement, and I recently joined, for example, DCU as an assistant professor on human-centered AI. I'm working in AI-powered translation, trying to reduce language barriers between limited English proficiency patients and healthcare providers, and trying to make both stakeholders involved in designing technology, okay? Because right now, it's only technology providers, the ones who design technology, and then, okay, you can use Google Translate, so on and so forth, so trying to change that thing. However, one problem, it's very difficult, at least from that academic perspective, to find collaborators or PPI contributors, both from clinical side or the patient side. So any recommendations, suggestions, or even interested people I'm around?
Lovely. That's a lovely preaching question, so thanks for that. Maybe a very quick answer, and then I'm sure there is more in the Q&A as well. No, you go on. Yeah.
I just want to say very quickly, I want to talk to you because we've just gotten funding to do some PPI in AI work, so I'd love to have a chat with you, yeah.
Great.
Yeah, the first place would be the PPI Opportunities Notice Board as well, but talk to the PM manager in DCU. There's a number of local partners, and depending on the area that you want, the network as it stands, we have, 10 national partners, 53 local partners, and a variety of other people we work with. So, it's about connecting those dots, so interact with your local program manager.
I think that's a question that a lot of people, especially new joiners, will ask, and I suppose the connection with your local people first, and then they can open up. Thanks, Emil. Any other questions? I have one very quick one then, if that's okay. It's actually a very general question about the future of the network. We know that now it's going to be our next steps. I'd love to see, how do you guys think, if you have to pick one word or one thing that you like to do, I know some of you have touched upon that, want to make it really more a network. So I know obviously lots of things happen in different institutions. How do we make it really all Ireland thing? Maybe one word that you think we can take from that, and I suppose then we can break for everyone.
Gosh, that's really hard.
I know I was going to be hard, but it's a general question. Yeah.
Like it's worked really well as a network because it's not a hierarchy. We are a network, and that has pros and cons. But I think it's the communication. It's nailing the communication so that everybody knows what's happening without everybody being overwhelmed, I think would be my way.
Yeah, I suppose I would say respect, relationships, and trust. Sorry, I'm using more than one word. Passion, integrity, those are some of my words, yeah.
Lovely. And keeping on with the C that Emma had said, I would say the idea of the collectiveness, the collaboration rather than competition. It's very much that collaborative space, very supportive, and in my eyes, a very non-competitive network amongst ourselves, which I think works really, really well and is really supportive.
Yeah, I agree with everything that's been said so far, and I think the communication is really important. We're entering a new phase of the network now. We need more formal, mightn't be, but structured kind of communication approaches, both within our local institutions, but also kind of broadly across the network. So.
I think for me it would be about emphasising the flexible, allowing the different approaches to PPI to flourish, allowing the different levels of training that people want to give or feel are appropriate to give, that we should really allow a lot of flexibility across all aspects of how there is no right or wrong way. It's all about trying to get better in how we do it.
Lovely.
Yeah, I think it's largely about mutual respect and trust. I think there's one thing that's for sure is nobody doubts anybody else in this network's motivation for doing it. And maybe it's because there's so few resources, no one imagines that anyone's in it for a power grab. I think that everyone who's in this is committed to it. And that's not just the lead sites, it's the partners, it's the 60-something local partners. I think just everyone's really committed. And I think that nobody's doing this just because they needed something else to do. And I think that's what drives it forward. Everyone's a champion.
Lovely, thanks. Sean, do you want to close the session? Okay. Well, then I'd just like to give a big round of applause to all our speakers. Thank you very much. And we break for coffee till 12.